Sexually transmitted infections, STIs, remain a major public health concern, and while innovative approaches to education and testing are being developed, significant gaps and challenges persist. The Walk-in Ruhr WR Center in Bochum represents an important step toward a more accessible, integrated healthcare system for sexual health, but its work also highlights the alarming trends in STI transmission and the urgent need for broader action. One of the most concerning aspects of the current situation is the role of digital platforms in the rapid spread of infections. According to data from WIR, around 70% of their patients find sexual partners online through dating apps or websites. This has drastically changed the dynamics of STI transmission, making it more difficult to track and control outbreaks. While online warnings and anonymous notifications are a valuable tool, they rely on individuals actively taking responsibility for informing past partners, something that cannot be guaranteed. Many people may choose to ignore the warning, delay seeking medical advice, or underestimate the seriousness of their situation. This creates a dangerous cycle in which infections continue to spread undetected. Even with increasing awareness, many people remain unaware of their risk. The introduction of anonymous online risk assessments and at-home testing kits is an important step, but these measures alone cannot replace structured healthcare interventions. A major concern is that individuals who test positive at home may not seek proper follow-up care, leaving infections untreated and increasing the risk of complications or further transmission. Without strong medical oversight and guidance, self-testing can lead to a false sense of security, as some infections require additional medical examination and long-term management. Another critical issue is the link between sexual health and trauma. According to WR, approximately 50% of their patients have experienced trauma, yet comprehensive mental health support for survivors remains limited. While the center offers trauma-focused counseling, this is not the standard in most healthcare settings. Many individuals with a history of sexual violence or abuse struggle to access appropriate care, either due to stigma, lack of specialized services, or financial barriers. The integration of psychological support into STI care is essential, yet it is still far from being widely implemented. Despite the promising aspects of WIR's model, such as collaboration between medical institutions, social services, and public health agencies, these initiatives remain isolated. There is no nationwide strategy ensuring that such integrated care is available to all. Many regions still lack accessible STI testing and counseling services, leaving individuals without the necessary resources to manage their sexual health. The reliance on NGOs and specialized centers, rather than a comprehensive public health approach, means that care is unevenly distributed and dependent on local initiatives rather than systemic solutions. The situation is urgent. STIs continue to rise, digital platforms accelerate their spread, and many people remain unaware of both the risks and the available resources. While innovative programs like WIR provide valuable insights into what an effective, inclusive sexual health service can look like, they also highlight the failures of the broader system. Without stronger public health policies, expanded education efforts, and better integration of STI care into mainstream healthcare, the progress made by individual initiatives will remain limited in impact. If these gaps are not addressed, infections will continue to rise, placing an increasing burden on both individuals and the healthcare system as a whole.